We are live, and ladies and gentlemen. You're once again welcome to another episode of the Kingdoms podcast. And I have with me a very, very special guest, a VVIP. Uh, she's commonly known as Besu, but her name is Dr. Adesuwa Eigbadon. How are you today, Dr. Desu?
Thank you.
Wow, it's nice to have you on the podcast today. Just before we hit the record button, you were talking about how it is your very, very first podcast. So, how do you feel me dragging you on your very first podcast?
It's very strange for me because, again, never been on a podcast.
Mhm.
So yeah, it's exciting. It's strange. We'll see.
Okay, okay. So, first question, and typically that's usually the first question I ask people when they come on the pod, right? I really want to know your personality. I really want to know what has shaped you as a person. And you would agree with me that childhood is very fundamental in shaping a human being, an adult human being. So for you, what was your childhood like and what was growing up like for you?
So, growing up, I had three siblings. My dad was a doctor as well. My mom was a trained nurse, but then she shifted to education. So growing up with three siblings was so much fun. It's a little chaotic sometimes, but I think as a child, I was always known as the goody goody two shoes child. And because I look like my dad, everyone would tell me, "Oh, you'd be a doctor one day too." So I think that's where the idea of being a doctor started from. Obviously, growing up in a Nigerian household, being a doctor, or even being an engineer or being in a bank sector is like a prestigious thing. So everyone's parents are always trying to the right direct
If you're not a doctor, you should be
a
uh,
lawyer,
a
being
lawyer,
banking sector.
engineer.
No one wanted a child to be the maid or what, and it's not bad. I think when you grow up and you explore that there are other possibilities other than just being a doctor, I think it blows your mind a little. Not at the age of 30, we're talking 20 something or not 30. But yeah, and they are also successful people who aren't necessarily in this line of jobs. So
Yeah.
yeah.
Wow, interested the African parents mentality, right? They want you to be one of the core professionals, right?
Yeah.
But for me, like I did not like being a doctor because of too much schooling.
It is,
You guys spent too long in school.
I think it's not even not only just the school. Once you what no one tells you is when you're done with medical school, you're still going to do some more schooling. Everyone thinks, oh, once you're done with medical school, you're done. I finished medical school almost 10 years ago now. And when I was done medical school, was when I was in the clinical aspect of my medical school, then I realized, hang on, I have 3 years left, but I'm still going to do a few more before I get to where I need to be to say yes,
Mhm.
satisfied. So it's only just last year I became a GP. And this took me change swapping from initially I was going to do obstetrics and gynecology like my dad. Then I was like, okay, that's too monotonous because my dad is doing it. My brother was doing it. I was like, I wanted to do something different.
Do something different.
Then yes, then I went into oncology, which is treating patients with cancer. And initially that was very emotional for me. I felt like I was crying all the time when I wasn't crying. And I finally got accustomed to having people die so quickly after you've just met them. I became very I think for me the straw that broke the horse's back was when my aunt died, my mom's younger sister. And I was like, it's fine, life goes on. She's died, just let's move on. And my parents didn't react immediately. They gave it a few days and they called me back and were like, that was not a natural reaction. That was unkind to your mother. She just lost her sister. You need to think of your actions and you really need to think about what you're doing with this job because that was not a natural reaction. We get it at work. You see people die every day, but this is family. You need to think about this. Yeah. And then I went, yeah, that is true. I've crossed the line somewhere. This is not working out for me anymore. Perhaps think of something else. And I really was passionate about oncology. So that's when I came from Nigeria to the UK. And I was like, I'll do surgical oncology. So then I did surgery for a year. And I was like, yeah, this is not for me. Because you go to work very early, you close very late, you have no personal life. It's like, I want a balance. I want to have conversations with people. I want to see and help. And being a clinician, sometimes the help, when you give the help to people, you'll see an immediate difference. Sometimes it takes longer, and that's fine. So the only thing I could think of to have that balance was GP.
Hmm.
So that's how I got into that. And here I am today.
Wow, interesting stuff, right? Just before I ask about your childhood influences, right? On the lighter note, there was something I read somewhere that said the mistakes of a doctor are in the cemetery, but the mistakes of a teacher are everywhere walking around.
True, true.
Like for doctors, when you make mistakes, like it's just straight to the graveyard.
Not necessarily. There,
Uh,
there may be some doctors or doctors. I think every doctor will make a mistake one or at one point or another in their career. That's a given because you're perfect. Some people leave with their mistakes.
Whoa,
So
that's
that,
crazy.
and yeah, sometimes it results in not every single patient that has died is out of doctor's mistakes or negligence, not necessarily. But yeah, sometimes they do lose some of the patients out of mistakes. It's a possibility. I can't think of anyone, but yeah, it's a possibility.
It's crazy how like in some professions the margin for error is very very slim,
Yeah,
right? So,
yeah.
so other professions the margin for error is quite wide. But we'll get back to that more later, right? Now, looking at your growing up, like who were those individuals you think were like your role models, your mentors, stronger influences that actually helped to mold and shape the person that you are today?
So definitely my dad. Definitely. I don't think I even one of the people I later got to admire was Ben Carson, but that was much later in life. I was already in med school at the time when I heard about
Whoa, then
what God
casted. I read this book, Gifted Hands.
yeah, yeah. But it
It's
was
almost influenced me to become a doctor, but
there
I had to
you
resist the influence.
go. To earn fight the power. No, but definitely my
I like I don't
yeah,
like too much schooling.
no. Which is the case in med school. You're literally trying to learn what is normal first, then learn what is abnormal, and then learn how to tackle what's abnormal and try and get it back to normal. But yeah, daddy, and then my brother later on when he started going to, I was still a child when he got into med school anyway. So the two of them, if I'm like, I didn't think of anyone else until when was someone went, "Oh, do you want to read this book?" And I read it. I was like, "Oh, that's good. That's impressive." But yeah, I think without my dad, I wouldn't have gone into medicine. And his own influence is a different story altogether. It's a very interesting story because he wanted to be a secretary, and then he got
Wow.
ill. Yeah, he wanted to be a secretary. Came from a very very poor home. His goal was to be a secretary. He got ill, and then when he recovered, he had to work as a secretary in a hospital, and he met this very 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 kind doctor who told him he was very clever and he could do it, and that's how.
Wow, what a story. Now, talking about your own story, right? You practice as a doctor. I'm not very conversant with the nomenclature and the jargons that you guys use in the medical profession, right? You practice somewhat, in Nigeria, and of course you also progressed your career in the United Kingdom. But then let's talk about Nigeria. Let's even talk about med school because med school is a whole journey on its own. Like you could write a book about med school. Like how was it
Oh
for
my
you? What were
god.
the challenges? At some point, did you ever think of giving up and doing another thing with your life? Just throw some light on the med school journey. What was it like for you?
I think when I got into med school, when you get into medical school in Nigeria, you must have been the local champion of your school. You must have been the best science student in your school to get into. And so I got into med school. Ahmadu Bello University Zaria, shout out. And I got into that med school.
One of the strong, federal schools from Nigeria.
It is. So I got into that med school.
The Ivy League, basically, to
I
give
was
context.
sorry.
I said it's one of the Ivy League universities in Nigeria,
It
to
is.
give
It is.
context to our listeners that are non-Nigerians.
Yeah. So I got at that time I was like very clever. I enjoyed reading. That was like my pastime. I loved reading.
Did
And
I
then
hear you say at the time you were very clever? Are you less clever now?
she was like, oh no, but you could tell me something and I could recall, it could tell me a group of numbers at the time and I could recall it back to you a week after without missing a beat. Now, not so much. I'll be like, yeah, you told me something. Look, I haven't got time for this and I'll walk away. But then I would tell so much patience then. And I got into med school and I was like, oh man, I'm a champion. I'm in med school now.
Sorry to interrupt you. Sorry to interrupt you, right? What you just said, like, brought something to my mind, right? Because I noticed something, but I don't know if it is like scientifically proven. I noticed that, when I was younger, I'm 32 now, but then
Mm.
when I was like in my teens, early 20s, I recollect that I could recollect things very easily, right?
Yeah,
My brain, it felt like my brain was on fire at the time.
yeah.
But as I begin to grow older, it feels like the brain capability is sort of like reducing, and you tend to rely more on the residual knowledge you have built from the past. So you get to do things faster based off experience, based off repetition, right? Based off recognizing things that you know from the past. But picking up new skills is sort of slower than when you were like way younger. Is there any sort of scientific uh
It's not as though
theory?
you have less ability to, you're just now set in your ways.
Ah,
There,
I need to go back to the
there
young
are
days.
people who are older than us who still go to school, to go to university, and they still are able to retain that. You're now setting your ways. You also have a lot on your table. You're trying to sort out. So you're not really paying attention to any particular thing to learn. If you wanted to, you would. But to be fair, especially in given the economy, not here, but all around the world, given the situation, everybody's just trying to survive at this time.
Mm,
No one is picking up unless you're intentional about it. You're not really going to learn something different. But yes,
mm,
children have a wide capacity to retain information. That's why they say, oh, teach children how to speak a language if you wanted them to at an early stage. If you
mhm,
taught 3 languages at a time, they will keep and be able to distinguish later on which is which and be able to respond to you accordingly.
mhm. But now like, it's difficult for me picking any language.
No. You're
I went to Lithuania and they were trying to teach me the language. The only thing I could just speak was achu, which is thank you. I said, okay, that's good. I'm good at this point.
you're set. You're set. You can leave
Oh,
there
wow.
now.
Yeah, so back in the days, I used to be clever, but now I don't know.
So yeah, it
Wow.
tends
So back to
that.
med school.
So yeah, med school. So obviously you then that's when you're as a Nigerian at least you're not exposed to the social scenario as well because you're like, oh, I've never like had to not do my assignment without someone going, oh, you need to do your assignment. You need to. So you're like essentially responsible for yourself. I think
Mhm,
the first year I did well. And then I got to anatomy. And now this is like little nitty gritty things about your body, your structures, the nerves, the vessels, what they're called, where they're located, what they do. And that's when I started to struggle. I was like, okay, I'm not as clever as I thought I was.
or you begin to second out yourself.
You do. You do because now they're throwing you information at you that you never really got in your science class when you were in secondary school. Because the first year was basically basic science, which I was great at already. So I was like, yeah, we've got this in the bag. But then when you start doing anatomy, physiology, community medicine, which involves calculation, which I loved to be fair, it became a bit of a tricky situation. And I think I started to hate preclinical medicine because it literally involved, and I had a few exams I had to rewrite, and I hated it. And I thought, is this for me? Did I rush because everybody went, oh, you look like daddy, you're definitely going to be a doctor? Because all the my second brother and my sister were very clever to run away from medicine. So
Mm,
that's not for them.
very clever.
So they were clever. I'm like, was I just dumb and just followed the advice of everybody? Oh, be a doctor. So I think I struggled, and I told my parents, I was like, I'm not sure this is for me. Maybe I should become a pilot. And this is where it gets tricky. This is when I knew I was proper dumb. They're like, oh no, become a doctor first, and then we'll become a pilot. I was like, okay, cool, let's do that.
Using a trick to cure another trick. Tricks on tricks.
That
Follow
was the
tricks.
once you became a doctor, you were set for life. So you were going to follow that path, completed it. So yeah, but time I got to clinical medicine, I started to love it because then you see the disease, you see the person who has the disease, you see what treatment is given, and you see the difference, and you're like, wow, that's impressive. And then I started to fall in love again with medicine, and more, and I never resat an exam after that because then I could see what we were talking about. When we were in pre-med, pre-clinicals, we're doing using cadavers, and they scared the life out of me. So
Wow.
again,
Speaking of
I was
cadavers, like how was it like for you emotionally? Because I can't think, I can't imagine myself, operating on cadavers. Just for the layman, right? A cadaver is, a
dead,
human dead body, right? And
donated
you
to
have to.
learn. Yeah,
I did not catch you. I did not catch what you said.
that has been donated to science for learning purposes.
Wow. So, like, you are operating on a fellow human being like yourself, that is
Yeah.
dead.
And they've been
I
put
think,
chemicals. So
wow.
once you get to do that, it's still not the same thing
Well,
because
the
you're dead.
first time, let's talk about the first time. The first time for you. How was the first time for you?
I thought I was like, are they really real? Is that because I saw it? I was like, no, it's a dummy. Is it really real? Is it really real? And then when we started opening it, I was like, oh, this is real. This is really real. Um, yeah, I think initially I was a little frightened. Then I got over it. But my brother at the time was almost about to finish his med school, and he came to visit, and he kept on making fun. He was like, "Oh, it's there! It's there!" He was like trying to scare me, and he was like telling horror stories. It's like, "Oh, I know a girl who went to the cadaver lab and she saw her auntie there." I was like, "Come on!" So he was scared.
What kind of- Doctors are dark humor.
He was legit trying to scare me. But I think obviously when you're exposed to this for a month or two, after it you get over it and you're like,
Yeah,
let's
it
just
doesn't mean anything to you again.
let's get it over and done with.
Wow. That's
Clinical medicine is seeing actual people with the illness, and then that's when I fell in love again with medicine, and I was like, yeah, I like this. This is for me. I want to make an impact. I want to make a difference in people's lives. Um, yeah. So yeah,
so
that was
as a doctor, you have that empathy. You see how people struggling with something, and you, by way of your service, it's more like a service to humanity, right? I think that's why you guys have that. Is it Hippocratic oath? You guys, swear.
yeah. So I don't think you can be a doctor without having empathy. You have got to be an empathetic person to be a doctor, to be a nurse, to work in healthcare. Because sometimes people will come to you with one thing and something else will show up. And you just sometimes all they want is a listening ear. They don't necessarily need you to just listen and be there.
Hmm. I said, let me put you on the spot now. Like, have you been in situations where a patient doesn't necessarily have a problem, but I think it's probably more psychological, and you have to use what do you guys call it again? A placebo effect, just to make sure that the patient is okay. Because for some people, I think it's more, of a mental challenge or psychological challenge than a physical challenge. So how do you
Mental
handle this?
health is something that's still being recognized all over the world. It is a disease on its own. It's like having a headache or needing an operation. It's that serious because they need the help, all the help they can get to get through the rough patch they are going through. So yeah, if someone came to me with a mental health problem, that is, I take that as a serious medical problem as well. And until we help you, we're going to keep seeing you until and um working together with other communities or other part of the medical team to see how we can get you back to being at least almost close to yourself, if we can get you back to what you were prior to. So yeah, um definitely listening to people, because some people just don't feel heard.
Yeah, very, very true. But then, like when they have medical practitioners like yourself listen, it feels like there's, a very big burden, that is taken off you. But
So
I imagine like the volume of people that you guys have to attend to, right? And
mm,
then you still have to listen to some flimsy talk from.
you know what? There's something I had to learn, especially here in the UK, which is something we never use in Nigeria. It's what is important to you.
Mhm,
That's a very important question to ask anyone. What's important to you? Because what's important to you is not the same thing as important to me. What's important to
mhm,
you is not necessarily the same thing as important to my husband. So what's important to you is very important. For some people, what's important to them is keeping them comfortable. Some
mhm,
people, what's important to them is making sure by no means do they die. So
mhm,
we all have a difference in what's important to us. For
mhm,
people's family don't see them suffer. So
mhm,
yeah.
mhm. Interesting stuff. Because I remember back in Nigeria, there was a day I went to see a doctor, and we were having some back and forth. He recommended something to me, and then I told him, "Oh no, I don't want to, take that kind of medication." And then I engaged this doctor in a conversation for like 20 minutes now, exploring like different things. And I think towards the end of the conversation, he just asked me, like, "Sorry, excuse me, um, what's your specialization again? Like, what did you study?" And I told him, "I'm a chartered accountant. I studied economics." I saw the disappointment in his face. I was like, "Why have I?"
Like, it is the usual line.
I saw the disappointment in his face, like, whoa. So this guy's not even into healthcare. And he has been, because I had done my internet research about these things. Like, how do you cope with those kind of stubborn patients?
You
That
know,
would
it's good.
argue.
It puts you on your own toes, and you have to go back and study. And for me, there's no shame in going, "Oh, I'm not aware of that. Can I go back?" But then you also have to recognize that not everything on the internet is true. Because
Mm-hmm.
I online on Google and write, "Don't eat bananas because if you eat bananas, you're going to have a really stinking breath." It's not necessarily true, but I've put it on there. Someone else will read it and they go and argue with the doctor. Not everything is true, especially here in the UK. We go by guidelines. If you go on the guidelines and you get something new, I'm like, "Oh, and I'm not aware." That's fine. There's no shame in this game. Thank you for letting me know. That's something for me to read, and I will go back and I will study, because I don't want to be caught by the next patient unawares to tell me that again. I'm like, then I start to have to ask myself, what are you doing? So if someone challenge me, that's fine. That's not a problem at all. It doesn't mean I'm going to dismiss you. It's not. I don't even tend to ask if you're a doctor or not, because you don't want to give special treatment just because of where they're from or what they do.
Mm-hmm.
So, oh, thank you for that. I didn't know about this. Or thank you for that. I will say that that's not true, because I hear a lot of funny things like, "Oh, if you stop smoking, you're just going to slowly die and deteriorate." That's not true. Will you struggle? Absolutely, but it's not going to mean you're going to die. So people get different information. You just have to source, where did they get it from? You will do some research. You can bring them back. Say, "Thank you for telling me. I didn't know that you were correct." Or, "Okay, I went through that. That's not necessarily the case. This is what the case is. Do you want us to try it this way instead?"
Hmm. Interesting. So, practicing in Nigeria versus practicing in England, right? Let's talk about the practice in Nigeria. What was it like for you?
I think in Nigeria, I'm trying to remember now. This is 5 years now. God Almighty.
It's been a long time now.
Oh my God. Okay. Um, I think because when I was in Nigeria, I was a much junior doctor, so there was a lot of supervision going on then. Not to say supervision now, but so you weren't like independently seeing a patient, so to speak. You'd always someone, which is still the case. Even as a consultant, you still have to discuss with patients if you're unsure. But I'm struggling here to remember. I really am. I think
But
the
in
last
terms of like the general practice, right, between Nigeria and England, there must have been like some differences in the practice. Just like for me, my own
oh yeah.
profession as well. Like I was doing the same thing in Nigeria, came to another big four firm in the UK, but then there's always like, cultural differences. There's always like, differences in practice and professional practice.
So,
Like, what
um,
were those major differences that jumped at you?
okay, so in Nigeria, if you're a doctor, you're like a god, you've made it. So whatever the doctor, oh, but the doctor says this or the doctor says that. Whereas in the UK, yeah, they come to challenge you to tell you, no, I don't agree with this. No, this is what I want. They come and tell you. In Nigeria, if they wanted to make a complaint, they probably complain to their family members. Here in the UK, if they wanted to make a complaint, they complain to your company, to your GP surgery or to the PALS team, and it will get to you, and you have to write an apology letter or write what has happened and why you feel like you weren't in the wrong, so to speak. So that's one of the difference. I think both countries show gratitude. To be fair, when they're
Mm,
happy. Um, um, it's not as though Nigeria doesn't have a set of rule. There was something that jumped up to me. We talked about this even within my own family, given that we have a few clinicians within us. This malaria typhoid rule where every patient will come, "Right, what's going on with you? I have malaria. Okay, what symptoms are you feeling? The usual malaria symptoms.
you
Where,
know,
where here in England, what's wrong?
honestly.
Yeah. Whereas here in England, you ask them what's wrong with you, they know exactly what they want to say. Okay, I've got pain here. See, my tummy right here is this way. Sometimes you have to leave them and be like, okay, is it a dull pain? Is it a sharp pain? But they know exactly what they want to tell you. And this is not every Nigerian will do that. That's not the case. But a good number of us will tell you, oh, I have malaria, typhoid symptoms. Even till today, people message me, I have malaria and typhoid. What do I take? I tell them that's not a diagnosis. The way they present are different. Don't let the pharmacies bamboozle you with the tests. You don't have malaria and typhoid. What is wrong with you? Tell me your symptoms. And then I go, okay, you need to see your doctor.
In Nigeria, it's crazy. It's crazy how I just remember something. I saw something on the internet a long time ago. I think when I was in Nigeria, and then there was this girl that said, "I'm having chest pain all over my body." Nigeria can just be very, very funny.
All over my body.
And like anytime you have a slight headache or maybe you're feeling feverish, they'll just say, "Oh, please go and buy
malaria.
malaria medication." And then, there's this friend of mine who came to the UK recently, and then all of a sudden, this guy called me. He was like, "Hey, Baba D, you get, you get malaria medicine."
Exactly. Exactly. We still have it ingrown. Somebody message me said I have chronic typhoid. I'm like, what does that mean?
I'm like, bro,
What does that mean? Chronic typhoid. What does that mean?
oh, like,
You know, yeah.
it's
But yeah,
crazy. I think one thing I noticed between like the UK and Nigeria is um the way medicines are really controlled. For example, antibiotics,
like,
you can't like easily
yeah.
get them in the UK, and in Nigeria. Come on, the chemist
That
will
You're
just distribute it to
you just tell him what is wrong with you. He will see what he can do.
you. But then how do you find that like the control here versus the control back home? Because I think like a lot of patients would have even like abused medicine before they even get to the doctors. I think for a lot of Nigerians, it has to be really extreme before they want to talk to a
To
doctor.
be fair, yes. Even my like I have
But
conversations with dad who's still running his hospital at this time, and he goes, he's he sees patients with more complications than he sees simple cases because they would have been to the pharmacy so many times to try over the counter medications. And it's not their fault, to be fair, because where's the money to open a hospital card to have a consultation to then get the medication in Nigeria? With the way the economy is, people are just trying to stay alive, trying to eat food, trying to make sure they have electricity, trying to send the children to school. I think the last thing they're trying to do is just get medication for malaria from a doctor because they can easily get it from the pharmacist as well, who will give them the same thing, but who doesn't necessarily have the knowledge of the pathology, pathogenesis, what the treatment is, and probably doesn't know that three illnesses can present with the same symptoms, but the treatment will differ for each of them.
hmm, wow. So let's talk about public knowledge, public knowledge issues when it comes to the practice of medicine. Because for me, being a professional as well, I understand that you are regulated by certain principles like confidentiality, right? Uh, you're not required to disclose, confidential issues,
Right.
right? However, there are like public knowledge issues, right? That's riddle or faced the health system in every country. So let's talk about like the major issues that face the healthcare system in Nigeria and the major issues that face the healthcare system in England, right? So if you were probably invited back home, as Minister of Health. Like, what are like some of the simple things you would like to, you've learned in England that you would like to like implement, back home?
So one of the things I would obviously love to do is make public healthcare free, especially for the poor, so that people are not dying senselessly for simple things. And I say this, and I could be wrong, because there are parts of Nigeria where the healthcare is subsidized for a lot of people.
Mm,
So, full disclosure, I haven't got much knowledge of what the policies are back home anymore, which is not
mhm,
what is the situation with me. So if I say, okay, I want to give free healthcare, someone on your watching your podcast and go, she's dumb. There's free healthcare already. What's she talking about? If that is the case, then make it public knowledge so that more people are aware that instead of holding your 3-year-old at home with malaria because you've been to the pharmacist twice and he says no. And this is not to cast pharmacists in a dark light, no, because I've got a lot of pharmacy friends who are very brilliant, but
mhm,
we know what our limits are as a clinician. What makes you a good clinician, in fact, is know what your limits are.
mm,
Okay, this is not for me. I can't sort this problem out. I need to potentially send this patient to someone else who can do it, or have a chat with someone else, a different colleague, and see what they think, what would be best. And I think that's one of the things I will definitely take back home with me and say, there's no shame in not knowing. There's no shame
exactly.
in going online to look at the textbooks to say, do this, or the guidelines to say, and I do it till today. I look at the guidelines to say, oh, okay, this is what it's saying. This is the recommendation. This is time limit for this medication. If it's not working, then let's try something else. I want our clinicians back home to know that's okay too. You
Mhm,
won't be frowned upon. You won't be looked at as dumb. It is part,
exactly.
but you can only hold a finite number of information in your head.
Mhm. That's actually very true, and I think it applies for every profession, right? So for
Yeah,
me, being a chartered accountant, a lot of people sometimes reach out to me and want to ask me for tax advice. I'm like, I'm not a tax accountant. I'm an auditor, right? You ask me about financial statements, I can advise you, but I
yeah,
refer you to a colleague that is a tax accountant. Even like within the world of audits, right? You have like different types of financial statements. You have different types of financial reporting standards, right? There are some that I am very conversant with. So, for example, I'm not very conversant with the ones that are used in the US. And then you're asking me questions about the US gaps, right? I'll refer you to a colleague who is an expert in that regard. But I noticed that like a lot of our people, like especially Nigerians, they want to look at you as though you don't know what you're doing because you have to refer them to somebody else. There's a finite, amount of information
sure
that you
that you
can process as a professional, and you owe, the public that, professional competence and
and
due care.
yeah,
Yeah, so you shouldn't be advising on what you don't know about. But in terms of like the public health space, I feel like there are like different issues that face these different countries. Like Nigeria is tropical medicine, right?
yeah,
So the kind of medical challenges that we probably would face in Nigeria will be quite different from what is applicable here in the UK because this is a temperate region. So,
yeah.
like, how was that switch for you?
Obviously, you have to go through a number of exams to move from practicing tropical medicine to temperate medicine. That being said, we do talk in med school. You are taught everything. They aren't just only focused on, oh, you're going to only learn about malaria, typhoid. No, you learn everything. Some diseases are same across the globe. Appendicitis, anyone. It's not picking age, race, size, gender.
Mhm.
Anyone can have appendicitis. Anyone can have a heart attack. Anyone can have a stroke. So some of the things were already basic, but some things, yeah, we had to learn, and that was fine too. Um, so you have to go through an examination process called PLAB initially. I think it's being changed this year, so that they know that you are aware of the kind of conditions present here, the common conditions, learn how to manage them appropriately, learn how to address patients appropriately, because that notion of, oh, you're a demigod at home has to be left at home. You don't traveling. These are
keep
the
it up,
travel
keep it up with Salah Mohammed Airport.
exactly travel here. It's, you treat everyone, and I mean, but then to be fair, this is something even my dad taught me, because even when I was growing as a child and he had a hospital. And I will never forget this. I was a child. I must have been less than 10. I remember running into the hospital and we're just like, playing around in his clinic. And I remember him asking, oh, did we greet the elderly woman who was the cleaner at the time? And we're like, no, she's the cleaner. My dad was like, I want you to respect everybody, irrespective of what they're doing. I will never forget that, to the point that now I'm very friendly with the cleaners, even at work. I'm like, hey, how are you doing? We talk about, how was your holiday? Because this is what I grew up with.
Mhm.
Irrespective of what you do. What you do doesn't make you a person. It's just something you have. Being a person, being a human being, is being respectful of everybody. So for me,
That-
transition from Nigeria, being respectful of my parents, patients to UK wasn't too hard. Even my colleagues when they were in Nigeria, like, you'll be fine. You're always already nice. You're always respectful. You let people to argue. They,
Mhm.
and I'm not an argumentative person, so I'm like, that's all right. So yeah, it worked out for me.
Wow. Like speaking to you, what you just talked about, like I don't like, basing your respect of, a person based on their position or their hierarchy. I do not like it. And I was talking to someone recently, right? They were surprised at how I respect, people that are like lesser ranked than myself, in institutions. And if I go anywhere, for example, I respect even the security guy, right? And the guy was asking me like, "What's up?" And that is the CEO, and you spoke to him just like you spoke to the security guy.
Yeah.
I'm like, I won't. I respect people because they're human beings, not because you are the CEO.
No, no, because of
I, I won't look at you differently because you're the CEO. I respect you, right? So
yeah,
you don't expect me to now start, trying to act in a way that is fake. No, you respect people because they're human beings, not
absolutely.
because they have certain titles. The
Yeah.
CEO could, be sacked tomorrow, right? So it
Yeah.
doesn't mean that you won't respect him
When that happens.
when that happens. So it's a tricky thing with human beings sometimes, right? They tend to respect you because of the title or the position you hold.
Yeah. Yeah.
It's,
Like, for some strange reason.
it's a crazy world, but I love it when our values like respect are highly upheld because there are certain values that are universal.
Yeah.
Respect is one of them, honesty is one of them, integrity is one of them, right? Yeah, there are cultural, differences, but it is always very easy to pick if a person respects you or not.
Yeah. 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 Absolutely.
Yeah, and that's like highly impressive, especially coming from professionals. It's interesting to note that across professions there are like certain would I say values or principles that are held really highly. I don't know the particular principles that the medical profession holds highly, but I would want to assume or safely presume that it will be the same thing with that of the accounting profession. For example, in accounting, we respect, professional competence, objectivity, professional behavior, uh, diligence and due care, confidentiality, integrity. And I'm sure that those are, principles that are also applicable in the medical profession. So these principles for me, I feel like they're universal.
Yeah.
Yeah, when you uphold them as a professional, like it makes you a high value, professional. But like delving away from these principles, looking at physical and mental health, I feel like they go hand in hand. But in back home in Nigeria, I feel like there's less emphasis and would I say less respect for mental health. Like, how was that switch for you, right? And like, how do you approach the holistic care of balancing, you know, the care for the physical and the mental aspects of healthcare?
Okay, again, I think that boils down to being empathetic. We obviously, if anyone has gone through med school in Nigeria, you will have some exposure to psychiatry, which is mental health. Um, and you do deal with it. You just deal with it a little differently. I know in Nigeria it's a lot more on the down low, it's hush hush. No one wants to talk about this family member with mental health problems. Uh, and some people don't even acknowledge it. And I think that has to do a lot with the stressors within the country. Which,
Mm,
like, the government bill them, is just trying to stay alive, just living day to day. They don't really want to deal with that, as opposed to this society where it's a working unit. Things are working here. So it's less stress. I'm not saying there isn't any stress, but just less stress on you, that you can actually recognize this is not right. I should address this so that I can feel fully myself. So I am well, both physically. And that's one thing with well-being. Well-being is not just the physical aspect of it. Physical, mental, emotional, and even on some level financial. That's the full definition of being well, well-being. So
mm.
realistically, back at home, a lot of people are well for the physical aspect of it. You only see cases in the
They don't have
psychiatric unit.
holistic well-being.
Sorry?
I said, but they do not have like holistic well-being, like a complete
So a few
well-being
people,
pack.
I don't think for them that's a priority. For them, they have way too many things on their plate to address that at that time. Maybe at a
Yeah.
later time, not with
Uh, but,
us. With
but what are the elements of complete well-being in your opinion of or your
so,
expertise experience?
so physical, mental, emotional, and even on some level financial freedom will make you feel better in itself.
Mm,
You don't have to be rich to the point that you're buying an entire street, but you also don't want to be in debt that you're always frustrated about just paying things off and not living life.
mm.
So obviously that's not coming to the doctor. That's going to a different expert like yourself. But
Ah,
but the physical well-being, the emotional, the mental, that's why we're here. That's why you've got family for the emotional side. But that's why we're here to so even in the GP, we don't only just look at you as the physical. It's one of my colleagues I really admire. Every time I read through her consultation, I'm like, wow, this is what I want to be. She's been doing this for many, many years. And by the time she's done with the patient, she's managed this patient holistically, not just that they came with a headache, but when they came with a headache, perhaps they told her they were feeling down. They also told her they were not living in a house. I tell you, by the time she's done sorting them out, you're like, I want to be her patient.
see it, say it, sorted.
And she's so good, and that's why I'm aspiring to do. Every time I go back home, I look at what have I done? What can I do better? And that's one thing about medicine no one tells you. You think when
Mm.
you don't, oh yeah, that's it. You're done. You're set for life. You will keep learning until the day you die.
Wow, it's a commitment, to learning. It's a lifelong commitment to learning as a professional. I think, yeah, look, all professionals, like, you just have to keep learning.
Yeah.
There's no stopping, except if you decide to pull yourself out of that profession. But it is a service to humanity. But looking at that service, it comes with a lot of gratitude, right,
Yeah.
from patients. So, like, what are like the memorable patient cases or experience you've had, that have significantly impacted you as a person, not just a doctor? Like what are those memorable patient cases that
So I can't
we've
give, I won't go into nitty details just because of GDPR, but I have
yeah.
got a card from a patient, and during our consultation, the young girl, we talked about the fact that we both love the Minions. What's the name of the movie? When you have minions in them, isn't it? Forgotten. Whatever.
uh,
She made a card with the minion on it, and she said thank you, and that really touched me. That's one
oh,
of memorable, like my biggest memories from patients. And then one not too far off was a lady who I found had a mass. She ended up with cancer. She was grateful for some strange reason. I was like, ooh, she's not going to be happy about this, but she was very grateful. So that's one of my memories about patients.
wow, interesting stuff. So now we have a rise in digital health tools and telemedicine. So like,
Yeah.
how do you see the role of GPs evolving in the future with digital
So,
health, and of course with the advent of AI as well?
mm. So we're just talking about this with colleagues about telemedicine. I think we've already been practicing that since the start of COVID, because a lot of surgeries went into telephone calls, video consultations, and we've seen where it's worked for us and we've seen where it doesn't work for us. Medicine is a science where you need to have both someone tell you a story and you need to physically examine them to help you delineate or at least narrow down your differentials to what you possibly think it is and manage accordingly. Because someone can come to me with a chest pain and there are certain features that will go, yes, definitely, this has to be a heart attack. And there's certain, you can just tell me it's a chest pain and you're not qualifying it very well. The only way for me to know is then tell you, invite you, come in immediately. I'm going to feel on your chest. If it's hurting when I touch it and it's tender and it's worse when you're moving about or lifting heavy objects, sounds more muscular than anything else. If that's not the case, then you have to start worrying because as a doctor, you have a high index of suspicions for anything sinister. You want to prevent that rather than going, oh my God, I should have done this. So the way you manage people, telemedicine is great for triaging, at least for now. It could be in the future, they'll find other ways to use it to manage cases. For now, how we say it is good for triaging in terms of someone calls you, tells you they have a headache, you try to describe the headache, you still have to bring them in at some point to do certain examinations, check blood pressure, look at the back of the eyes, things like that. Feel the tummy. Um, because again, during COVID, while it was great at that time because of the social
Exactly what was on my mind. Yeah, the
yes,
restrictions.
yes. Now everything is back to what it would ordinarily be with the face to faces because we've realized that's the best way to practice medicine.
But COVID definitely has changed the way
Oh
we
yeah.
live our lives, whether we like it or not.
I think without COVID, we probably wouldn't be doing as much telemedicine as we are doing now in terms of calling to triage and all of that. It probably would still have been a lot of face to faces going on. And it's not to say there aren't a lot of face to faces going on. There are, at least in my GP. I've seen even the four GPs I've worked in. There's been a lot of face to faces, regardless. But we do a good number of telephone calls to triage, especially first thing in the morning. Know who you're bringing in, know what you can do quickly for them, know how to triage, sort it out, send it to the specialist where they need it.
Interested. So speaking of COVID, like where were you at the time of COVID?
Oh
Were
my!
you
So when COVID first announced, I was in Paris. I was enjoying a holiday,
oh
and then I came back and they told me, "Oh, things are going to have to change. We're going to do 4 days on, 4 days on." I was like, "What?" And I was in London, in London in general surgery, and I think for me, they were the best group of people. They were funny. We were like a family. Literally, we were like a family. We'd all go to lunch together. We'd all come. We were like crabs. We all walk to lunch together and walk back together. And with social distancing, that had to change, and it was so strange. And
yes.
usually, we'd all see each other chat. We had to be less every day so that we could afford the social distancing. Because if we're too much and we're crowded in a room, then it's not possible. But yeah, after that, shortly after that, I moved to Lincoln, which is in the Midlands of the UK, and I started my GP training then. And it was such a strange thing because everybody was keeping more to themselves, which made it very difficult when you've moved from a place where you felt like you were in a family to a place where everyone wants to just keep to themselves because of the COVID. So that was a little rough. But I think one thing with loneliness is you get used to it after a while. It just becomes, the quiet becomes normal. The being by yourself becomes normal. So what I would do on the weekends when I was not working is I was get in my car, drive. I'll pick a place in the UK, drive there, explore, get back in my car and come back.
Wow.
So that having a monotonous weekend every weekend, as long as was within 2 hours or less, I would do that. If it was too far, I wasn't going to do that because I didn't want to get exhausted before the following week.
Mm.
But yeah,
Wow. But then, what are you most grateful for about the COVID era?
I think for me personally was I learned to be by myself. I learned to enjoy my own company. That's
Mm.
one thing. I learned to enjoy my own company. I got to understand myself and know myself very well, which was strange because it's what you say when you're early 20s, not in your late 20s, entering your 30s. But I got to know myself, which was great. Yeah,
Yeah, that's very important. Sometimes that alone
yeah.
time is very, very important, and then you get to discover. A lot of people did discover themselves during the COVID period, because I think as well, like a lot of people discovered inner gifts in them that they really did not utilize, prior to COVID. And even a lot of people discovered that they probably did not have like a proper relationship with their families prior to COVID. So it's just like they were living in houses wherein like their family members are like strangers. And then they
Yeah.
were not forced to bond.
Forced to know them. You're forced to know them.
They're forced to know these people.
I,
That was quite an interesting period.
also
And
the
then
talentless outside of medicine because I got a
um,
guitar too, and I never played it. It was making so much noise. I was worried my neighbors were going to call the police on me. In fact, my doorman said, "If you can't play, can you let the rest of us sleep?" I was like, "Sure, sure, sure, of course." And I was on the fourth. So
wow,
yeah.
what a period. What advice do you have for young people out there, who would like to study medicine, who would like to become, medical practitioners, and also other young people who would like to chase their dreams outside of medicine?
I will say this: consistency is key.
Mm.
Keep trying. Yes, you don't succeed. Try and try again. Cheesy, I know, but it has happened to me. I failed an exam. I thought, this is it. I'm done. I'm getting out of it. But my parents, surprisingly, my mom, because my dad is usually the softer one, my mom is usually the disciplinarian, was like, try, try again, try again, try again. It wasn't like I was failing times. Let's keep the context clean. It was just one time. But but it was like, try again because that one time was enough for me. Given that again, like I said, I was the champion in secondary school, was getting all the prizes. So when you have that first failure, it's like a big blow to you. But
Mhm.
yeah, I tried again. So even if it happens so many times, who cares? Do it. You'll get there. You get what you want. You get to where you want to be. And only do what you feel like you're in love with. Otherwise, it will feel like a chore every day.
Mhm.
There's the hours, holidays with families. But if you love it, it'll be worth it.
Hmm. Interesting stuff. So, in your opinion, like, what are like some effective strategies to promote preventive healthcare and encouraging, patients to adopt healthier lifestyles?
Um, so I think the obvious ones: diet. Look at your diet. I wouldn't say cut anything off. I'll say eat a healthy portion of everything. Exercise. That's one thing a lot of us neglect because of our busy lives, our busy schedules. Even if it's just 3 times a week for 30 minutes, go for a run, go for a jog, go cycling, just 3 times a week, 30 minutes. You'll see how much of a difference it'll do for you, not just only your physical health, even your mental health, because it will release the happy hormones, pheromones. Yeah.
Hmm.
Uh,
Interesting.
have create time for yourself. That's important. Have some downtime. Watch a movie if you like. paint if you like, go do gardening if you like, go bungee jumping if you like. Anything that relaxes you, you do it. Because at the end of the day, you want to be wholesome. You want to have the physical, the mental, the emotional, and even the financial. So you have to create that time.
Interesting stuff. What quick one? You mentioned you touched on exercise. But what's your opinion on like wearables and tracking? Exercise metrics. Wearables like our Apple Watch and stuff like that we use for tracking.
So they are reliable. I have asked a few of my patients, "Oh, have you got a smartwatch? Well, what's your heart rate at the time if they had a problem with the heart rate? What's your blood pressure if they had a problem with the blood pressure?" Or all we tend to do is just compare it clinically to see if it's the same with our devices or not. Even if it's not, we'll just advise, okay, this is not the case. So they don't worry too much. If it is, then we'll investigate or be like, okay, great, that's a great tool or great device. I
Mhm.
know I have a colleague of mine running a co-clinic with me a few weeks back, and someone had a smartwatch that could trace his heartbeat, which I thought, wow, this is very clever. Made me feel very old because I didn't know that. But I thought that was very clever. And I thought, yeah, that's a great tool to remind you to work out, to remind you to drink more water, to remind you to keep moving.
Mhm.
Yeah.
Mhm. And it does all those things, and sometimes when you are having like this high heart rate, then it gives you that warning that, oh, it gives the heart sign, like,
Yeah.
oh, interesting stuff, right? Yeah. If you can afford one like it, I think it's
Yeah.
always a good idea to have these things to track the metrics. Because for me, I'm a numbers guy, right? Like, yeah, if I can't see the numbers, it doesn't really make much sense to me. But when I see those numbers, like, for me, it makes a lot of sense. Because how much do you say, oh, I exercise weekly, right? But how many minutes, right? Like, how many calories are you burning?
Burning.
Stuff
Yeah.
like that. I
Yeah.
need to see those numbers, and when I see those numbers, I think it makes more sense to me. But I don't know for like other people.
I wouldn't say work with numbers all the time. I'd like be happy with how you feel and how you feel you should look. Because
Mm,
you can 60 kilograms and be happy with the way you look, and someone else is 60 kilograms and being unhappy with the way they look.
mhm,
Be happy with the way you feel. Yeah, it's good to track. Oh, I'm just seeing a bunch of planes flying together. That is cool. Anyway, it's good to track for exercise because that reminds you if you're being a bit sluggish or you're being doing too much, which you could
mhm.
never do. But yeah,
Okay, interesting. So, finally, like, what do you find most fulfilling about your work as a GP, and what keeps you motivated on a day-to-day basis?
I say this everyone to my husband. The minute I stop enjoying this job, I will stop it. I will stop it and look for something. Enjoy what someone asked me this at work the other day because I was on a duty shift and it's a very quick shift. You've seen emergencies quite quickly. And I said, he asked me, why? You must be crazy to do this. I was like, I know, but I enjoy it. I enjoy meeting people. I like enjoy having the conversations. I enjoy seeing how I can help, whether it's by myself or referring to a colleague. I enjoy the follow up, making sure they've gotten better. I enjoy it. It's just
Mm,
being human, which is we all are losing in the world, that our humanity. And I've always, I think from childhood, I've always gone, I want someone to know that there is a God.
mm,
So, and I'm God, but like God exists, and I want to always be kind. I want to always be honest. I want to always be transparent. I want to always be helpful to people. So yeah, I enjoy it. The patients, I always get good patients. They're always lovely. They're always thankful, which is great. You will get complaints here and there. Obviously, that's part of life. You're not jollof rice. Not everyone is going to love you. Even jollof rice, not everyone.
even jollof
But
rice, not everybody likes.
so you're going to have the good and bad of it all. But you should enjoy what you do. It should make
Mm,
sense. You should see
not everyone will like
like
you. I like
whether they
it's
say thank you or
what's
not.
written on my wall.
What's written on your
I
wall?
like that. Yeah, not everyone like you. It says, please to remember, tomorrow is a new day. Making mistakes is part of life. Not everyone has to like you. Keep an optimistic attitude. Beauty and strength come from within.
There you go. There you go.
So it's part of the mantra. Not everyone will like you. Not
Yeah,
everyone likes Jesus. So who are
and
you to
that's
be like?
fine. That's fine. I don't take it personal. That's fine.
Interesting stuff.
Everything we comment is bad, and that's part of life.
Mhm. Great stuff. So at the end of the podcast, we have a tradition wherein you answer a question from the previous guest and you leave a question for the next guest. So the previous guest actually dropped something interesting for you. Do you want to know what he
Oh
is?
my God.
Interestingly, he's an engineer, right? But
Okay.
an interesting person. Do you want to know what he's asking?
What was he asking me?
He's asking Drake or Kendrick.
Ooh, I want to rap now.
Yeah, like one of your hidden talents, aside from being a doctor, right? Is you're a rapper.
Just to put it out there, I don't rap in public forums, but I know a lot of Drake songs and I rap a lot of Drake songs. I do. The only song from Kendrick I can remember is Shut Up, Sit Down, Be Humble.
Be humble.
But with Drake, I rap for days. So I'm going to have to go with Drake.
Whoa! So there you have it. Okay, Chuku, she has gone with Drake. So, what question would you like to leave for the next test?
Which country do you want to travel to and why?
Which country do you want to, or next? Which country do they want to travel to?
Travel to next and why?
Right. Oh wow, interesting. So the next guest has their work cut out for them.
Yeah.
So, do you want to leave a shout out for anybody before we say goodbye to the audience? Shout out time.
To everyone who's listening on here, thank you for joining in. I'm sorry I have bored you for an hour. Okay, lightly.
No, we've had episodes that have been more than 2 hours. So, like, this is
Oh my
not.
God. No.
Yeah,
Honestly, I
this is not a big deal.
onto the podcast. It's been interesting. It's been fun. And hopefully I'll do more podcasts. Thank you.
Wow. You're open to the idea.
Sorry, I didn't catch that because the network went really shady.
I said so. Now you're open to the idea of doing more podcasts.
Absolutely.
Interesting. Before you go, I'm going to put you on the spot and play.
Sorry, just one moment because your network is like very shaky. What did you say?
Shaky, right? I said before you go, I'm going to play a game with you. Like it's a top 10 game, right? So, what countries do you think are top 10 by population in the world? In the top 10,
China, Nigeria.
Okay, wait. So by the metrics from world,
No, I'm going to.
population.
I don't even know the metrics. I'm going to definitely fail.
So world populations, right? So you mentioned China, right?
Yeah.
Yeah. So China is number 2 in the world right now. Did you?
Number 2. Who's number 1?
Yes. Do you want to know who's number 1?
Who's number 1?
Take a guess. Yeah, who
United.
could beat China? Who could possibly beat China?
Oh my God. Nigeria?
No. India. India is actually number 1.
Oh yeah, that makes sense. That actually makes sense. India,
Yeah.
Nigeria.
Yeah, India is taking over from China. China was number 1 for a long time. I remember, but India is taking over slightly. Number 2 is China. You mentioned United.
Yeah.
Right? Yeah, United States is number 3. And of course, you mentioned Nigeria. Nigeria is actually number 6 right now.
Wow. So what's number 4 and 5?
Can you take a guess? Just take a guess. What countries do you think are going to complete the top 10?
So let's delineate now, or let's narrow things.
Elimination.
Is the elimination process really? Is it in Africa or in Asia?
There are quite a number of countries in Asia on the list.
Okay.
So what? Yeah, you had to go for Pakistan, right? So Pakistan, I'm going to share my screen with you right now.
Yes.
At number 5. So who else do you think is on the top 10? Let me remove the top 10 from you so you'll see it.
I'm not even sure. Now I'm realizing that I need glasses. Okay. So
okay. Yeah, like the Asian countries. Another Asian country, the name sounds like India. So
Indonesia?
Indonesia is number 4. Pakistan is
Whoa. Never have guessed Indonesia would be number 4. Yeah, Brazil.
uh,
Hey.
6.
Bangladesh.
Brazil is number 7. Bangladesh is number 8.
I was going to
Russia
say
is number
Russia.
9.
I was actually going to say Russia at some point. I was like, really? Okay. But yeah, great, great. And
Oh, wow.
then
Huh?
Mexico.
Number, yeah. So there you go.
Brilliant. Clever man you are.
So at least we're able to, yeah, maybe learn something. So shout out to everybody at home.
Yeah.
Okay. For me, to you, it's a very, very big thank you for giving us more than 1 hour of your time, from your busy schedule. Just to give this context, I've been chasing Dr. Desu for how many months?
Just
I'm finally,
to put it in context, I've got a lot of work and personal commitments that I'm trying to
yeah.
sort out. I wasn't
It's not easy getting. It's not easy getting a doctor like this, to share time with you. And when you get it,
Oh, come on. Oh,
you need to
come on.
show an attitude of gratitude so that it can elevate the magnitude of your altitude.
You can now tell he's just being goofy. He's not even being serious about it.
Oh, so thank you very much. For me, it is peace and love.
Thank
God bless you
you.
guys.
It was
Okay,
great.
bye. We are
Thank you.
out now.
Bye.